Hi, Dr. Joshua here, and I want to talk to you today about filler through a medium we can all relate to, which is the Netflix binge. More specifically, Pretty Little Liars and forehead filler. I want to discuss and compare two specific characters of this series, which are Jenna and Allison. Jenna is the brunette on the left, and Allison is the blonde on the right. When we look at their foreheads, we can see that they have very different light reflection and shadows on their forehead, and they seemingly have very different eyebrow positions as well. See, at first glance, we would be inclined to think that Jenna's eyebrows on the left are lower and Allison's eyebrows on the right are higher up. But when we actually measure the distance from the apex of the brow to the mid-pupil, we see that the height is actually the same. So what does this mean? Why does the height of the brow look so different, but when we actually measure it, it's very similar? And I'll explain why. It's due to the light reflection on their foreheads. See, Jenna has a very hollow forehead, whereas Allison has a rounder forehead, which is aesthetically more pleasing and gives more support to her eyebrows. So here I've marked the hollow or concave on Jenna's forehead versus the rounded or convex forehead of Allison. And you can see it without and with the lines. And then you understand the difference. And what this hollow does is it causes the light reflection on Jenna's forehead to be divided in sort of an upper and a lower band of light, whereas the light reflection on Allison's forehead is a nice central circle of light. So here's another picture where you can see that there's kind of a divide in the light reflection where she has a strip of light bouncing off her forehead between the eyebrows and then one high up in the hairline with what appears to be a hollowness in between. Whereas compared to Allison here, you can see that it's a nice and even central circular light reflection across the entire forehead. So generally, when our forehead appears hollow, then there's some sort of transitional groove from the forehead to the eyebrow, which makes our eyebrows appear heavy and droopy. This is acceptable in men because they're supposed to have flat and low eyebrows. But in women, it can give them an aged appearance, which is aesthetically less than ideal. Another great example of that is my lovely patient from last week, Lotta, who, due to long corticosteroid use in her childhood, had a lot of bone resorption, which primarily manifests in the jaw, chin, mid-face, but also the forehead region. And you can see in the three-quarter view really clearly that she's quite hollow, and how nice it looks when that's corrected in her after photo to give that nice round, smooth forehead. So in general, for women, it's ideal to have a nice, smooth, round forehead that smoothly transitions into the eyebrows. Whereas with men, it's not so much an issue because they can have a little bit of a ridge. So I'm hoping that clears up the question that many injectors often get, and that is, why would anyone ever want to fill in their forehead? Some people genetically are quite hollow there, and it just brings their eyes and their eyebrows out more to smoothen that out. There you go. I hope that answered your questions about forehead filler. Should you have any more, then you're welcome to ask them in the comment section, and I will try and get all of you.